Yeah.
But I haven't like that because I'm not doing constantly going like this.
Yeah.
Warm off.
Okay, new development at age 40.
I know. Great, I'm welcome development. I know. Why are there so many of those things that I'm warning about?
Just after this year, for my regular prescription, my regular thing, and now we're in contacts plus.
Oh, great.
Yeah.
Great. That's all right. Yeah, another later.
Hold on. Okay. Mary, are you okay if we move this just a little bit for when Lauren gets up there?
Huh?
Is it okay?
It'll
if we
move.
Oh, yeah,
Once
that's,
she gets up there.
once it's moving. Okay. All right, I'm gonna get a vibe check in.
Hi, good morning. Okay. How do you want me to pose? No, I'm just teasing.
Not that idea. Check
It's Friday.
Yeah, and then
The weekend.
It's Friday and it's raining.
it's a great day for a drink up on rating. Get out of the office, but it's nice to get outside for your. So where's the best place for me to stand, do you think? Like, so that people will see.
The cameras, it'll follow you if you want to walk around a little bit.
Okay.
So we're go ahead and get started. I can be seen, yes. So I just wanted to thank everyone that is here and in the ether for attending today. For those of you that don't know, this is a Family Shade event. Family Shade is a partnership with the Parent Information Center of Delaware. Family Shade's mission is a collaborative alliance of family partners and organizations committed to improving the quality of life for children and youth with special healthcare needs. And so this event is a really great example of that. We've got some parents, we've got some professionals here today, we've got some great community speakers that will be talking from their walks of life, their experiences, and their professional background. So we really look forward to you all being here today. If you have any questions, comments, thoughts afterwards, please just jump in. This is going to be a really intimate environment in person, and then for everyone that is virtual, we have a moderator that will be watching. So without any further ado, I wanted to introduce our first speaker. So for those of you that are in-house, you've got to meet Lauren a little bit in passing, but I wanted to read her bio because it's going to have some really great information. So Lauren is the Transitional Social Worker Coordinator for the Transition Plan Program, which we're going to hear a little bit about today, at Nemours Children's Health. She is the head role for the last 4 years, and before that, she worked with Christianacare Health System. So two big pieces in the community that you probably have all heard about and maybe have even attended. Lauren has also, she is also a licensed clinical social worker, and she received her bachelor's in arts and psychology from the University of Michigan and a master's in social work from the University of Pennsylvania. So local, which is always nice because we all know the Delaware and the tri-state area has some of its very own specific experiences. Lauren is also, with her plenty of experience in transition to adulthood work, she is also the mom of 3 young adults, 21, 20, and 17. So before we get started with Lauren, we always like to have a little bit of feedback. I mentioned questions, but we'll also have a poll for those of you that are online to give us some feedback with our information. And then as I've spoken to all of you that are in attendance in person, we've got some questionnaires that are in your folders. Anybody that's not here, you'll receive the information that parents and professionals received in their folders after the event. So keep a lookout for that. So without any further ado, I welcome Lauren.
Thank you so much.
Thank you.
Thank you so much for having me. I love to talk about transition. It's one of my favorite topics, and I talk about it all day long. Welcome to you on the virtual option. So I'm here to talk a little bit about the transition plan program, which is where I do my work, but also some other things too. Uh-oh. I'm the worst technically. I will just.
No, that was me.
That was you?
Yep.
I thought I did it with the clicker.
Okay.
I'll also say that I'm not used to presenting in person anymore, so this is like a good entry back into being in person. So today I'm going to talk a bit about the transition plan program. I'm going to talk about just some common issues encountered in transition to adulthood and talk about some various resources in our community because like Jaleesa said, every state is very specific about their resources. Every state is very different with their resources they offer. And then I'm going to take your questions. So think about if you have any questions, kind of jot them down, and we'll get to those at the end. So just a little bit more about me. I work in a pediatric facility now, but most of my experience is in the adult world, specifically with people with disabilities. So I come to this role with that experience of knowing how things work on the adult side of things. I was with Christiana for most of my career, and specifically with the Center for Special Healthcare Needs for, like 14 years or something like that, so a while. So when I talk to folks who are transitioning from pediatric to adult services and medical, I kind of already know what's out there. I kind of already know how things work for the most part. So that's just a little bit about my background. So what do we do at the Transition Plan Program, which stands for Preparing for Life After Nemours? Most of you probably know that Nemours has very strict age limits. So we don't have much flexibility after the 21st birthday. People really need to transition to their adult providers. There are a couple of exceptions. And I could talk about those in detail if people want to hear about that later. But for most people, their 21st birthday is their last day at Nemours. So my job is to make sure people have a plan and that they know who their medical team is going to be and what services might be helpful. So to that end, we do 90-minute consultations. Our appointments are 90 minutes. We really get to know each other once a year until people age out. So maybe we'll see a 20-year-old for the first time and just make sure we get them, suggestions for providers. Maybe we'll start seeing somebody at 16 and just see them every year until they're 21. It really depends on the family and how much support they want. People are typically referred to us through their doctors, but people can also self-refer. And I did put some of my cards at the front. If you wanted to self-refer, you can feel free to do that. So Dr. Amy Renwick and I see the patients together. So she typically starts with her part. And she talks a lot about the medical team. Who are your adult specialists going to be? Who is your primary care doctor going to be? She also talks a lot about emergency planning and like making sure that you're safe in the community. So it's really worthwhile to get her content. And then I talk about some more of the psychosocial things, which we'll talk about today. Right now, we have a long wait list right now. So what we started doing is I'm talking to people under 18's families by phone as an initial, let's just start talking about transition. So if your young adult is 17, you would typically get a phone call from me offering a phone consult just to start talking about, like, I usually just lead with what's keeping you up at night, like what's on your mind. And then we'll kind of go from there, make that connection. The next year, they'll come in for an official visit with the doctor too. So Dr. Renwick covers who's going to steer the ship when your young adult is no longer at Nemours, no longer under pediatric care. So we talk a lot about who is your adult medical team going to be. And this is actually a source of a lot of stress for a lot of families because sometimes they don't know what the resources are. Sometimes they've heard from other parents. It can be difficult, especially if you have a complex medical history, to find a good fit for adult care. So we talk about that. We talk about who are your specialists going to be. We also talk about some of the limitations if you are a person with Medicaid, some of the limitations in the adult world regarding going out of state, which are not present in pediatrics. So we kind of tell people, like, you really want to stay in your state. You have to stay in Delaware unless the service you need doesn't exist in Delaware. Then there's the opportunity to go elsewhere. But sometimes people will come in with a plan like, oh, I'm going to see urology at Penn and I have health options. And usually that's not going to really work out. You need to see urology in Delaware, you know, if it exists, which it does. So we'll talk about that in a minute. We talk about dental. So that's a significant concern for a lot of families, especially if you're a young adult, maybe can't tolerate a dental session while awake. So that's a concern that people have. We talk about eye care. We really talk about the whole person and like what they're going to need to be okay as an adult. I just heard myself. So I want to make sure everybody knows about the Center for Special Healthcare Needs. And this is probably the #1 place that we refer folks. So, and this is where I worked before I came to Nemours. So I have an insider's knowledge of what goes on there. So the Center for Special Healthcare Needs is located at the Wilmington Hospital, and it's a medical home intended for people aging out of Nemours or pediatrics who have complex medical conditions or social conditions who need a little bit extra. So the appointment times are longer. There's social work support. You do not get that in adult medical care usually. There's case managers. There's a lot of support. They really wrap their arms around you as a family and provide the supports that you might need. Oh, it's accessible. They have wheelchair scales. They have, for people who struggle with maybe blood draws, they have phlebotomists who will come into the room. So there's a lot of special accommodations built into this practice. And then there's some things that you don't have to be a primary care patient to access, like the adult CP clinic. You can have a primary care doctor around the corner from you if you live in Dover, let's say, and then go see the adult CP clinic for a yearly consultation. Urology for adults with special healthcare needs can be extremely difficult to find, but they have a practice there. So you don't have to be a primary care patient to access the adult urology. And we see they see a lot of patients with spina bifida, and that can be really hard in the adult community to find. So it's a great resource. I could probably talk for hours about all the good stuff they do. And they have a lot of doctors who are med peds, which is they're certified in pediatrics and internal medicine. So they understand childhood onset conditions. And that can be really helpful when you have somebody who's had a condition since childhood. There's the adult Down syndrome clinic. I mean, seriously, this is an amazing resource. So I wanted to make sure I covered it. Now, if you have friends in another state nearby, you could rest assured that there's something similar in Pennsylvania at the Navy Yard is the Jefferson Fab Center for Complex Care. Very similar mission. New Jersey has Risen, which is very similar as well. And Penn actually has a good adolescent medicine program that is sort of like a bridge between pediatrics and adult care. It goes till 29. And they see a lot of complex patients too. So there's resources if you have friends in Pennsylvania, New Jersey. I don't really have anything for Maryland, to be honest, but there are other places that do similar things. And they all kind of started at the center. So a lot of the people who started the center have branched off to other states. So it's all sort of the same cloth. So I don't have that much time today because I could literally talk for many hours. I'm not going to do that to you all, but I'm going to quickly touch on the domains that I cover as the social worker for transition and the things that are sort of at the top of mind of many families. So I'm going to talk about all these things a bit. Probably not working. Maybe I'm pointing at the wrong place. Okay, I got it. So people oftentimes are thinking about, gosh, where's my young adult going to live in a year, in 5 years, in 10 years? What about in 30 years? People are thinking ahead. And that's one of the things that I sort of just touch on, like, what are you thinking about? It's okay to change your mind, as time goes on, circumstances change. There's different things to think about. I'd say the majority of people I work with are kind of looking toward being at home with supports, like home with family or home with a loved one with supports. So I don't know if you can see it there at the bottom, but your local Center for Independent Living can be really helpful if you're exploring options for independent living. You might have to point it over here. I'm sure there's a sweet spot. I just don't know what it is. Okay. So what I always tell people is that the most important thing, in my opinion, is getting connected with the right resources to support things like housing. So to that end, what the heck is a waiver is this slide, because people are almost always confused about it. And it's something that I really like to cover for people so that they have a clear understanding of what it is. So waivers, you might have heard the term and been like, okay, I'm not sure what that means exactly, but they're for people with disabilities and chronic health conditions. It allows Medicaid to waive their usual rules to be able to provide the supports for people to live in their communities. So before waivers existed, if you had a special health care need and you couldn't be independent, you would live in an institution. And a lot of people lived in institutions and really didn't want to, but there was no other option because Medicaid wouldn't cover something like, home health care, private duty nursing, home accommodations. So people were really limited to just being in an institution because they weren't able to be cared for at home. The waivers they provide most of the supports adults with special health care needs need to live in their communities with the supports that they need. So they're very good things. Every state has their own way that they do it. We're really lucky in Delaware that we don't have a wait list right now. Most states have a wait list for services. So Delaware people move here specifically for this. So an example that I give people is regular Medicaid is not going to pay for your home modifications typically. But if you have a waiver, they would consider paying for home modifications so that you can stay in your home as long as possible. Another example is typically Medicaid's not going to pay for private duty nursing, but the waivers support private duty nursing so people can live at home and get the nursing care they need. There's a lot of other things too, but it's important to decide which waiver you want to go with, is my point that I make to people. Let me do this. Oh, you're just going to do it. So in Delaware, and this link is, you may have seen it, it's like a comparison of the two waivers in Delaware that most people use. You have to decide between them. You can't have both at the same time. So some people, maybe you've heard of Lifespan through DDDS. That's one of the waivers that supports people who have disabilities over their lifespan, basically, very descriptive. And then some folks opt for LTSS, which is through Medicaid, it's through your MCO, so either Health Options or AmeriHealth, whatever MCO that you have, you'd have a case manager and they would provide the services. They're not the same, but they're similar. So that's why I included that comparison sheet, because you can look at it and say, okay, well, for example, one of them provides vehicle modifications, the other doesn't. One of them provides job supports, the other one doesn't. One of them provides, if somebody wants to live in a group home, the other one doesn't. So there are some significant differences, but you can switch. So that's the important thing to keep in mind. People agonize over which one to pick, but you can switch. You're not locked in for life. So sometimes needs change and you have to switch. But it's good to think about which one suits your needs the most. So that's my spiel on waivers, and I can talk more about it if people have specific questions. So then people are always thinking about what's going to happen when school's done, because school provides so much structure and support and things to do, and you can work because you're young adults in the school and they're okay. So people say, will my young adult work? Will they volunteer? Are they going to go to like a day program, like a recreational program? Are they going to go to college? And there's a lot of options these days. I just yesterday spoke with the Classic program at the University of Delaware, and that is a really neat program. Oh my gosh, if you don't know about it, definitely check it out. Those young adults are just learning so many different life skills and independence skills, and we had the best conversation about transitioning to adult medical care and why do people need doctors. We just had such a great conversation. It was awesome. So I did put some links on there to learn more about what's out there for a college type of program. So either a Classic, which is not a 4-year degree, but it is a certificate. And now it is actually there's the option to go into 4 years of that program. It used to be a 2-year certificate. Now it's expanded to 4 years. So, and the young adult can live in the dorm if they want to have that dorm experience. They get a lot of supports. They get peer mentors. Well, I'm not advertising the Classic program, but it's a really neat program to check out. There's also, for people who have autism, University of Delaware has Spectrum Scholars. So I put that on there too. And that is a 4-year degree, but with additional supports, specifically for autism. And then Think College. If you haven't looked at Think College, definitely check it out. It's really cool. It's, they have all the programs out there for people with maybe intellectual disability who want to do a college type of program. When I was at Classic yesterday, I met people from a bunch of different states. People are coming to go into different states to have that college experience. So another thing I'm always really, really emphasizing to folks is to connect with your voc rehab, connect with DVR, because DVR can help pay for programs like this. DVR can help you figure out what you want to do job-wise. DVR can help a lot of times if you want to learn how to drive, but you need some specialized instruction. They do a lot of things. So I'm always like, just get in contact with DVR. They can help you on a number of different fronts. So that's sort of the way that I direct people. And then, of course, Pathways to Employment doesn't have the upper age limit now, so that's a great resource as well. So always feel free to talk to your DDDS community navigator or your LTSS case manager, or call your Medicaid and talk to somebody from care coordination. They can help with resources as well. So I feel like I spend half my life talking about SSI and SSDI. And I'm not a lawyer. I don't work for Social Security Administration, but I've learned a couple tricks along the way. And so I just wanted to touch on this a little bit, just because it's such a big topic that people want to talk about and people feel confused about. Okay, so what do you think a B has to do with SSI? This is your brain teaser of the day. Does anybody want to guess?
No, we need to protect these, so we protect SSI.
I love that. Does anybody online want to guess? Can you see the chat?
Mm-hmm.
All right, I'm going to tell you, because I came up with this myself, so it might not be very obvious. Okay. A lot of times, people apply for SSI for the first time, and SSI stands for Supplemental Security Income. A lot of times, people apply for the first time at 18, because under 18, your family's income is counted, so you might not qualify just based on that. So a lot of times, families who maybe were over the income limit before, the 18-year-old is looked at as their own household, their own person. Their income is what matters. So most 18-year-olds aren't really raking in the big bucks. So that's a lot of times people apply for the first time at 18. Okay. Or if you previously denied, definitely apply again at 18. The B comes in because 18-year-olds are looked at very differently than under 18-year-olds when SSI is in play. SSI is looking at you as a worker bee. There's the B connection, the worker bee. They're looking at your ability to work to support yourself. You have to also qualify financially. You can't have more than $2,000 of assets. But their main thing is they're looking at you as a person with a disability and saying, is your disability going to get in the way of you reaching a certain amount of monthly income? So people a lot of times don't realize that. So that's why I like to explain that really clearly. And so if you have a disability that is possibly going to get in the way of you being able to work, it's called substantial gainful employment. So it's like there's a dollar amount they look at. So if they think that, let's say you have a disability and you can't do certain things, but you could do a desk job, like you could work in customer service or something like that, they might deny you based on that. Like, oh, well, you could work. They're really laser focused in on you working. So that's just something to keep in mind. That link at the top is just an easy way to apply for SSI because you fill out the link and then they contact you. And then it timestamps that date that you expressed interest so that if you do get approved, you get back paid to that date that you filled out that link. So I like to always mention that as well. And then people a lot of times will hear like, people will hear like little murmurings of like, oh, it really matters like if you're paying room and board to your family, if you're going to live at home. So your living arrangements influence the amount of you could possibly receive for SSI. And I put a link to that so you could look at that. But they're going to ask you if you're going to plan to pay your fair share of household expenses as an adult. That is what they're expecting you to do. And that's really what they want you to use that SSI money for, to sustain yourself in terms of shelter and food. That's like where they want the lion's share of that money to go. So they'll ask you questions to that end. So that's just sort of like a really broad overview of SSI, just a couple tips that I like to run by people. Insurance is also something that I cover quite a bit because people always apologize for being confused about insurance. And I always say it's confusing. Don't apologize. It's so confusing. People aren't sure what's Medicaid, what's Medicare, like how can you have both? It's a lot. So usually I just sort of make sure people know if they get SSI, automatically they're going to qualify for Medicaid. You don't have to do anything separate. And that's not the case in every single state, but it is the case in Delaware. And then people worry that like, okay, well, let's say I get SSI and Medicaid. Does that mean I just have to sit at home? I can't work? So then I talk about like there's a ticket to work program. There's other programs that are tailored to workers to be able to earn money and still be able to get some benefits, especially the Medicaid, because that's really important if you have a waiver to maintain your eligibility for the Medicaid. So that's definitely possible to work and still get these benefits. And then people who don't qualify for SSI, which is, a lot of people, they still could qualify for Medicaid based on having a low income. So I always encourage people to try to get Medicaid if they need insurance. And then if you get SSDI, you'll get Medicare eventually. And some people with disabilities will get SSDI based on maybe a parent's work record, if that parent has passed away, or if that parent is on disability themselves, or if that parent is retired and collecting collecting Social Security. They might end up with Medicare, and then a lot of times Medicaid as well, because you can have like a whole host of insurances. Just it's important to know Medicaid is always going to be the payer of last resort. They're always going to be the very last one to pay. But, it's good to, if you have the Medicare, to keep that Medicaid as well. And there's ways that you can do that. And then, having private insurance through your own job or a parent. And a lot of parents don't realize that sometimes an adult child with a disability can stay on your insurance longer, depending on your HR's, particular, you have to kind of contact your HR and ask about your particular insurance. And there's like a bunch of paperwork, but it is possible. If you feel like you really want to keep your young adult on your insurance past 26, just ask your HR about disabled adult children if they can stay on longer. So if you're a person who's going to get SSI, you have to realize that you cannot have that much money in your name. You can't have that many resources in your name. Right now it's $2,000. You can't go above $2,000. And that figure hasn't changed since the 80s. They were trying to boost it up, but I think it got denied. It didn't work out. So it's important to know what you can do to be able to save money and have money that doesn't count against your ability to get government benefits. So maybe you guys have heard of the ABLE accounts. I put a link for that. And that's a special savings account for people with disabilities to be able to save above that $2,000 limit and still qualify for SSI and Medicaid and any other benefits they're getting. And you don't have to stay in Delaware. You could look and see, maybe Ohio has a great ABLE program that you like. You can do a different state. You don't have to stay in state. And then the special needs trust is a little bit different because you have to go through a lawyer to make sure that it is set up correctly. But it's so that you could leave somebody like an insurance policy or a large amount of money and not have it count against their ability to get their benefits. So these are things that people sort of put in place to make sure that their young adult is taken care of, but also doesn't lose eligibility. Like the worst thing I've seen happen is when somebody really means well and leaves a young adult like a bunch of money and then they lose all the benefits that they'd worked so hard to get. They lose their waiver, they lose their SSI, they lose their Medicaid, and it can really blow somebody's life up. And then that money usually runs out pretty quickly, and then you have to start all over again trying to get it done, and it's just honestly a nightmare. So definitely something to think about there. So I don't want to step on Got Transition's toes because I know we're going to hear from them, but this is a one-pager that I use for almost all my patients, and it just says, it's just what turning 18 means for your healthcare. And it's a really easy way for young adults to understand what is going to change at 18, and their parents too. I'd say if I could summarize it, the main idea of it is when you turn 18, your health information becomes private, and you have to say if it's okay for other people to have access to it. So we were talking about this yesterday with the classic students, and they were like, oh, okay, that's why I'm always signing consent forms. Okay, that's why people are always wanting to talk to me instead of my parents, and if I need help, I have to say that I want them to help me. So we always emphasize to people, it's okay to get help. You can ask for help. That is totally fine. You can have people in your medical visits with you, or you don't have to. I had a patient a couple weeks ago who said, I really don't want my mom in there with me. And so she wasn't. But she came back at the end when the young adult wanted her to be able to hear some of the content. So the young adult really becomes in the driver's seat at 18. And then that kind of leads to the question of decision making. And that's something on the mind of parents. It's a big concern. I think I spend most of my time talking about SSI, decision making, and waivers. That's probably what I talk about the most in my life as a transition social worker. But I always think of decision making like a toolbox. So your biggest tool is that saw, and that's guardianship. But maybe you don't need the biggest tool. Maybe some of those smaller tools might suffice just as well. So that's something that we talk about in our clinic is what of these smaller tools, these alternatives to guardianship, might you be able to try before you go for that guardianship, which is the biggest tool, the most restrictive option, the option that really removes the rights of most of the rights of a person and gives them to somebody else. And really the court system now has sort of shifted to asking that question, what else have you tried? What alternatives have you tried before you enter into trying to get a guardianship? They want to know that now. So that's why I make sure that people know what else is out there. So I put some of these resources in the PowerPoint, but supported decision-making is a great tool that, again, Delaware's a little cutting edge sometimes. It's a small state, things can get done. Does anybody have a familiarity with supported decision-making?
We have.
Okay, great. Do you want to say what it is in your perspective?
No.
Okay. So supported decision-making is considered an alternative to guardianship that is legally recognized in Delaware. Not in every single state, but it's like I said, we're sort of on the cutting edge. It's becoming a very important tool for people to be able to get the help they want, get the help they need, and it doesn't take anything away from them. They don't give up any rights. It just, they're able to give their parent or a trusted adult rights to get information, to help them understand information. And that combined with a HIPAA release or a release of information, a parent can really continue to assist their young adult understanding medical information to the degree the young adult wants that help. So it's a very great tool that we're lucky enough to have access to. And I did put, the link is more information about supported decision-making and the actual agreement that you can fill out. And it's free, which is nice too. Guardianship's really expensive. So it is free and it's a great tool. And then sometimes I'll say, well, what makes you want to pursue guardianship? Like, what are your reasons? Like, why do you think that's a good choice? And people will say, well, I want to help them with money. Like, I have to help them with money. But being a representative payee for SSI and SSDI gives you that ability. So you don't need guardianship to help somebody with manage their SSI and SSDI. Okay. Thank you. And then again, the HIPAA releases are really important. The healthcare power of attorney goes a long way in getting that assistance. And these are all free, except for the special needs trust. Yeah, I have to go to a lawyer for that one. But and then the final thing I just wanted to make sure people know is that Delaware has a state law that says that if somebody can't make their own medical decisions, they don't have a guardian, but they also can't understand enough to do a healthcare power of attorney, their next of kin automatically becomes their decision maker for health decisions. So when people are in a panic because they haven't gotten a guardianship or they can't afford it, I'll always print that out for them, that state law, so that they know they're covered and they can advocate. But we barely scratched the surface, so here's some resources that you'll have in your packet. And then we talk a lot about independence in our clinic and taking control of your healthcare to the extent that you can. I just think it's important to note, yesterday I talked to the classic students and they're all like 18 to 22. And I asked them, how much do your parents like get involved in your healthcare decisions? Like, do you ever feel like they overstep or they're making decisions for you? And they're all like, so they're like, we want to participate. We want to learn how to do this stuff. And it's just, as a parent, like, you're used to doing things for your kids. You want them to be so safe and happy and healthy, but it's important to make that conscious decision to kind of let them try, let them fail sometimes. And it's the hardest thing. I'm a parent too. I totally get it. But they want to make their own appointments sometimes. They want to learn how to do a refill. So that's something we talk about in clinic. And then assistive technology is just an important thing for people to know about and to know what the state assistive technology resources are. And then we talk a lot about recreation in our clinic, and there's a lot of new stuff out there right now, actually, for self-advocates. So you can take a look at that. Hey, I did it. So if there's times for questions, I'm totally willing to answer any, but if not, that's okay too. And I do have a couple of pages of resources for you guys to check out.
And will we get a copy of these slides?
Yes, you do.
There's a copy in there, but afterwards I'll send out Lauren's PowerPoint so that you're able to access the link.
That's what I was looking for.
Yeah, and my contact information is there too. So if you do run into a question or you want to just like talk through something, feel free to call me. Like I'm an open book. I'm always willing to have a conversation. You can consider me a resource for transition things.
Thank you so much, Lauren.
You're welcome.
And we will likely circle back to have you come and do this in a longer presentation because there's so much information and I'm sure that there are questions, but just kind of take it all in. And so just thank you again because I always learn when I hear.
You're welcome. Yeah.
When you said how you open a conversation with what keeps you up at night, I was wondering what kids' responses are and how you address that within the parameters of what you do.
Yeah, so a lot of times when I ask that question, it's when I'm doing the consults with the parents because the kids are younger. So a lot of times that's how I start the conversation for the parents. Like, what are you worried about? What are you thinking about? For the kids, when they're in clinic, a lot of times we'll just start with like, what's on your mind? What are you worried about for the future? What are you excited for the future? And a lot of times it's like, around work or around being independent, or sometimes there's a clash between the young adult wanting to be independent and the parent not really being ready to let go of that. So we have a lot of hard conversations in clinic sometimes about that. But a lot of times I find that when I make my phone calls, my consults, parents are just really stressed and have a lot of things built up that they're worried about that they haven't really said out loud. So sometimes it's nice for them just to sort of vent. And then I'll say, okay, well, let's talk about like what resources would be helpful so that you can know that there's going to be a plan for the future and you don't have to, just agonize over that. Like a lot of times people are agonizing because they haven't gotten guardianship yet and they thought that they had to, but they can't afford it or they feel guilty because they just don't know how to do it. And then I'll, of course, mention that state law and just say, don't panic. Like we'll have a conversation like that. So usually it's the parents that I'm asking what's keeping you up at night. The kids are usually more, they're more worried about their futures and being independent.
Thank you.
Anybody online that wanted to say anything? Oh yes, that is a great resource, the Dell Hub, and I should have had that on there. I gave somebody, I gave the classic students there's an app, a Healthy Transitions app. I gave that to the students at Classic yesterday where they can like play games around transition. They can watch videos of people making their own doctor's appointments. So yes, online person. Thank you so much. That's a really great point. That's a good resource too.
There was another question. Oh, one down, Mary,
But I'm trying to make sure that.
right there.
Well, regarding the recreation, I put some ideas in my PowerPoint, which online will get that too, right?
Mhm.
Yeah.
Yeah, so you'll see my suggestions for different volunteer and, well, not really volunteer. I would say for volunteer stuff, go to Voc Rehab or Pathways to Employment to get their ideas. But like just purely recreation, I put like my top suggestions in the PowerPoint. All right, well, I'll step down.
Thank you, Lauren.
Thank
We will have time for questions at the end as well.
I'll be here the rest of the day.
So next, we're going to have Derek Robertson present. He is going to be via Zoom, but I wanted to give some information about Derek. Derek Robertson is the president and co-founder, along with his wife, of the Maryland Sickle Cell Disease Association. Derek and his wife have 3 sons, 2 of whom have sickle cell disease. He is the member of the National Everyone was talking earlier about their glasses, and I don't have mine, and you don't have to be old to need glasses. So Derek also received, he holds an MBA from City University of New York, Baruch College, with his JD from the University of Houston. He is licensed to practice law in both Texas and Washington, D.C., and is currently certified in the healthcare compliance by the Healthcare Compliance Association, and is a practicing volunteer mediator in Howard County, Maryland. Derek is an attorney specializing in federal 340B drug pricing discount program, and he has worked extensively with hospitals and universities on federal grants and management of the program. So Derek is going to be with us, like I mentioned, via Zoom, speaking on the GOT transition, healthcare transition resources and checklists.
Thank you. Thank you very much for that introduction. Can you guys hear me okay?
Yes.
I'm just going to assume that you can. I guess it doesn't matter at this point. So, so thank you guys for having me. I'm going to try to share my screen. Let me see if I'm allowed. Oh no. So, Jaleesa, are you going to be able to allow me to share or?
Yes, so Mary's going to do that right
Okay.
now. You should be able to.
Okay, great. So, yeah, thank you for the introduction. Like I said, I'm in this role. I'm my role of parent, and my wife and I have 3 sons and 2 have sickle cell disease, and they're now the ones with sickle cell disease are now 25, just turned 25, and 23. 23 will be 24 later this year. So we kind of still in the middle of transition. You know, they're still adulting, even though one would think that they're getting there, and I think for the most part have made that move. But we'll talk a little bit about some of that as it relates to insurance. So as I get ready to share, we'll be talking about the transition healthcare transition toolkit. And so we can bring this up, share. Okay, so I should be able to now go into the, let me minimize this. There we go. Okay, so it should be in presentation mode, and acknowledging the folks who actually did this presentation, Annie Schmidt and Becky Harmon actually prepared. So I just have the easy task of making the presentation. So, and I'll just get started. And okay. Okay, so let me minimize this so that I can see. Here we go. Great. All right, so that's just our funding disclaimer. So this project was funded by the Health Resources Services Administration, and they're not responsible for the content. Got Transition is. And let me see if we can, where does this go down? Okay, there we go. So this is what we're talking about in terms of healthcare transition. I know Lauren went over some of this already. The two main goals is to make sure we're improving the ability of young adults to manage their own healthcare and ensuring that the process between pediatrics and adults are as efficient as possible. So we know from studies that the better structured healthcare transition is, we're going to get improvements in healthcare, we're going to get improvements in the patient experience and how young adults utilize care. And all the major organizations, clinical organizations, American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Physicians all recommend that youth, whether with special needs or without special needs, should have a structured healthcare transition process. And those 6 core elements are on the Got Transition website. We talk about that later. And we're not going to show this video, but there is a video on the website that you guys could take a look at. Okay, so the toolkit we're going to go through was developed by an advisory group, and you can see the members of that advisory group to Got Transition. And as you can see, it's a wider range of organizations that came together to try to put or give input into the family toolkit that you have. The toolkit really looks at 10 key questions that Got Transition believes are key to just asking and helping parents in the transition process. And I'm not going to read all of these, and they're not in any particular order because, some folks might want to really, what's top of mind could be the 9th question down, which is like, what are the differences between pediatric and adult care? You just want to get used to that. But we feel that these questions, as we go through them, and that's what we'll do today in the presentation, are key to helping be prepared for a structured transition process. So when should I start to talk about transition? So you developed a timeline starting at age 12 and continuing through age 25. Although, there's a transition, a nurse practitioner, Dr. Barbara Speller-Brown from Children's National, and she likes to jokingly say that she starts transition as soon as the patient can talk. And so it really is a process. We started at 12 in this kit, but it's really never too early to start talking about transition and just making your child more aware of their role. And so you're going to encourage your preteen and teen to ask their own questions about their own health, moving on to letting them practice making their own appointments, and ordering prescription refills. Nowadays, ordering refills is automated, something that youngsters are very familiar with. So sometimes you don't even have to talk to anybody to order your prescription refill. You're going to work with your teen and doctor to make sure that they have a medical summary as they're getting older, because the time to transition is approaching. And Lauren just mentioned about turning 18, and we have that slide that Lauren mentioned, because it really is a key point in that transition. So a lot of practices, you may not move from pediatrics to adult until 21 or 22. Some are 18, but some could be as old as 22. But that doesn't mean that at 18, your legal rights haven't changed, even though you may still be in a quote unquote pediatric practice or getting admitted to the pediatric hospital. And then as we get into age 25, making sure they understand a lot about health insurance. We're going through that with our son now, who I mentioned is 25, and we're impressing upon him that, 26 is coming soon, and you're not going to be able to be on our health insurance anymore. What does that look like? Is he going to have to get into we're in Maryland, I should have mentioned. Well, I guess the Maryland Sickle Cell Disease Association would give that away. But just making sure, is he going to have to go into the health exchange that Maryland offers to get subsidized care because he's not working full time, and having that discussion with him, because that for us at this point is one of the most important things for him to understand. And, we still haven't, I think, done a great job in transitioning the insurance responsibility, over to our sons. And, even though they're doing their own appointments and stuff, I don't think they have a good grasp of insurance. And like Lauren said, it's confusing and for everybody. So some of the healthcare transition services, there are certain clinical recommendations for healthcare transition, and these are all available on the Got Transition website. And we want to make sure that we're going through this process, as we call the 6 core elements, which is, making sure that there's a transition policy, making sure that there's tracking and monitoring, there's readiness, that there is, planning around transition, the actual transfer of care, and then completion. But this is all there. So some of the questions you can ask your child and ask your doctor about transition for healthcare. For example, when you're beginning the process in adolescence, it's like finding out definitively what age you're going to have to change to a new doctor. Because like I said, in some institutions, it's 22, in others, it's 18, some it's 21. So you need to really get a handle on exactly when that is. And asking about suggestions for adult doctors. And I think it's also great to talk with, if you can be a part of a network of parents and others in your particular disease state, because I think word of mouth from other parents as to who the provider you should be going to, I think is also excellent, and not just asking the other doctor, but asking, other parents as well. And, when you start meeting on your own and becoming more independent, and a lot of that, you can also, drive yourself. And what about health insurance? And again, that's really key. We were just this week had our legislative day for sickle cell, and one of the advocates was explaining to our Senator Van Hollen, just how expensive it is for lab tests, and making sure, does your health insurance cover labs? What's your copay? Is it different, for the specialists, and is it different for the adult versus the pediatrics, and just making sure you have a good handle on that. And before again, we mentioned the medical summary before, and I think that's something, just making sure that your records are being transferred over. You're not always in the same institution going from pediatrics to adults. Sometimes it's going to be going from one institution to the next, or it could be going from an academic institutional setting into a private office setting. So you want to make sure that that's, well coordinated. And the changing role as you go through, and there's a chart that we have here that Got Transition developed, and it really shows, how we think that the roles can change. So it starts with the parent being the provider of care, and the child is receiving it. So if you have a 6-year-old or 7-year-old, you are really providing that care. And the child, but even that, like I said before, even at that age, is nothing wrong with asking him or her, do you have any questions? Like you said, they're beginning to develop their own mind and their own sense of what's going on. And then as the child gets older, they're going to provide some of their own self-care, and then the parent becomes more a manager of care. So in our experience, our youngest son has sickle cell. Well, he has a comorbidity with asthma, and as he got older, he learned more about how he needed to take his inhaler, making sure he had his inhaler with him. We stopped having to remind him, to put your inhaler in your backpack. He started doing that, a little bit more. And we just had to come behind him, every now and again and check, hey, do you remember your inhaler? Again, he played a lot of sports, and then he learned, from experience, if he didn't take his puff, 30, 40 minutes before his game, then he might run into a little bit of trouble. So, he began to manage his care more. And then as he got older, and as your child gets older, then I like that word consultant, because you're just there to make sure that things are going well. So as he got older, we would maybe a little bit, we might remind him, remember to ask about X. Remember you had this going on last month. You might, when you're meeting ready, to remember to ask, oh yeah, sure, and that sort of thing. So that's the process that we go through, and eventually the youngster becomes the leader of their own care. So now he is doing postgraduate work, and he's not here. He's in Massachusetts, and he has to navigate it on his own because we're just not there. And so, and he has had he'll still call, and we'll make recommendations. One of the things we talk about, making appointments for doctors, and this is where I think as an adult we can still help. Learning not to always take no for an answer. So he might call and say, well, the doctor said I couldn't get an appointment until June, and it's like, well, ask them if they have a wait list. Can you wait? If they can get cancellations, did you really explain the urgency of why you need to see the doctor? No, I didn't. I just said I needed an appointment. Well, explain to him that you have some really acute pain in your stomach, and that might trigger them to get an appointment. Don't just speak with the coordinator, the appointments coordinator. Ask to speak with the clinical team, because sometimes the appointment person is just in front of a computer and they're just looking at a schedule. If you get to speak with a clinical person, a nurse, social worker, then you can explain more with what's going on clinically, and they may be able to send a note to the doctor and say, we need to get you in a little sooner. And you don't know what you don't know, but as we have had those experiences ourselves as adults, that's the type of consulting you'd want to be passing on to your child. So how can I learn if my child needs help with decision making? There's this tool, and it doesn't have to be as formal as, hey, here's this chart you have to fill out. We really think that, and how some of these questions you're going to be doing as well, but you kind of want to make sure that you can use this tool as a guide. You can use it to know what type of questions, you're going to be asking of your child, to make sure that you understand just how ready they are in terms of getting ready to transition. And so this is a good tool that you can just utilize over time, and you can see at different stages of your child's development how they understand the consequences of refusing medical treatment, or how they understand the reasons why they take their medication will change over time. Maybe they didn't know before. Do they know the dosage, as going from I take this, white tablet to I'm taking 300 milligrams twice a day, and so our son, one of the medications that's used to manage sickle cell disease is hydroxyurea. But the dosing can be really strange, so he had to be taking one dose, 1,000 milligrams, one tablet one day and then 2 tablets the next day, and trying to understand how that works. And in the beginning, we used a pill box, in this day, and then eventually he came up with his own system to know which days of the week. If it was an odd day, he was taking 2 tablets, an even day, he's taking 1 tablet, so that's the type of things that you want to make sure that they're ready. And so these questions, I think, provide a good guide to how that could be developed. Okay. And I think Lauren mentioned this in her presentation about turning 18. And it can be sometimes really frustrating for parents. A little anecdote, our son who doesn't have sickle cell, we were actually away with one of his younger siblings at a baseball game. We were in Hershey. We got that, dreaded call at 2:00 in the morning. Our son had been, and he was in college. He was an undergrad at University of Maryland at the time, and our son had been in an accident. And so we called, and all they would tell us is he's stable. And as you can imagine, we're kind of freaking out. We couldn't get any details. Eventually we were able to find out that he had actually been hit by a car, and so we're driving this hour and a half, from Hershey in the morning, and we know nothing. And that's because he was over 18 and they couldn't tell us anything, and we hadn't put any, we didn't have anything in place with the providers to make sure that he could provide consent for them to be able to talk to us and give us that information. So it's really important that you have that conversation with your 18-year-old and making sure that, they understand that if they don't give the permission for the providers to talk to you, they just can't talk to you. And so it's a really important time to do that. Turns out my son, he had a broken toe, but he was otherwise okay. But it was a little harrowing then. So the differences between pediatric and adult care. And again, these are just questions that you want to understand, because the adult world can be a lot different than the pediatric world. Their whole mindset is different, and sometimes folks think, let's say the transition is at age 22, that they're treating you one way at 21 years and 11 months and 30 days. And then on that 31st day, when you turn 22, all of a sudden you're an adult and you're looked at differently and you're being talked to differently. In the sickle cell space, it's especially challenging. A lot of sickle cell patients need opioids to manage their pain, and young adult males, many of whom are African American, young adult females, have no issues getting the medication they need in the pediatric setting. They move over to the adult setting, and all of a sudden they're drug seeking, they're stigmatized, and understanding that you may not be able to change it, but being more prepared for it can be beneficial. And so that's something that we face in the sickle cell space. There may be other challenges in other spaces, but the general idea of just understanding, how your pediatric experience is going to differ from the adult. It could be the physical space, going from a children's hospital with nice paintings on the wall, and it's just really a welcoming environment, to going into the adult hospital, which is, less that. And I think that it's important to be prepared, and getting your child to understand those changes as they move through the process is really important. Okay, so again, this is some of the paradigm shift between pediatric and adults, and you can see here the different approaches that are taken, and this is very general in terms of adults versus peds. We can see what's there. All right, so is your child ready? And again, some of it is also related to parents, right? Are we ready for transition? And so this is a readiness assessment that you can use. And the sample here is for parents and caregivers. Online, there's also the readiness assessment for the person living with the disorder, right? And so sometimes the two don't line up. So you may be thinking your child is not ready and they're thinking they are ready, or vice versa. But again, this is a tool that you can use to go through to see just how you think your child is ready for transition. And this is one, if you have intellectual developmental disabilities, you can fill that out for your child, or to the extent that they're able to do it, and they're trying to do it themselves. Online, there is a healthcare transition quiz, and there's a link here in the presentation. The link actually works. If it doesn't work, you can just go to the Got Transition website, and there's actually a drop-down menu, and you can get to the quiz, and it's really short, and you can take the quiz. You can take it, like I said, and the youth and the young adults can take the quiz themselves as well. And so again, just summarizing what is healthcare transition, and I've used the word process a lot, and I think that that's really key to understand that healthcare transition is not an event. It really isn't. It has to be a process that starts as like I said, as young as Barbara would say, the child can talk as early as 12, and you going through with that process. And these are just some of the resources that are on the Got Transition website. That's all from the website. Again, there is toolkits are in English and Spanish. There's the video and other resources. And that's what I had. So I'll see if you have any questions or thoughts or sharing your own experiences. And Annie and Becky, like I mentioned, they really prepared this presentation. And I just presented it. And I think we have some folks from the Maryland Sickle Cell Disease Association online. So welcome to them, to Pam, and glad you could make it. All right, so I'm going to stop sharing. That's okay. Stop sharing.
Thank you very much. I wanted to let everyone know, so folks that are here in person, gonna go back up, so that everyone can see online. So the folks that are here in person, you all have the HCT, or the healthcare transition checklist. So that is one of the large pieces in the toolkit that he was talking about. So you'll have a copy of that. For our people that are attending virtually, we will send that entire toolkit out after today's presentation. So you'll get it before the day is over, in case you'd like to spend some time this weekend looking over it. Something that's really great that I'm sure Derek will speak to as well, but in our last event when we talked about this, this is a great toolkit, not just for families, but to share with any professionals that you're working with. So Lauren uses it frequently with her families, but it's a really great opportunity that if you as a family or you as a parent are using it, bring it into your office and saying, hey, have y'all seen this? Is this something that you're comfortable using? Can we go through this together? Because it's an opportunity for you as a family to use it, share it with your practitioners, and then them to come through and support the next family. It's almost like a pay it forward. Now, we know that as parents, you all have a lot of things on your plate, but this is a really great way to take some off your plate and to support the next person that comes through. This is something that's being shared throughout Delaware more and more. Thank you, Lauren. And of course, thank you, Derek. But it is really something special to get out there. So in case we have any questions, I wanted to make sure that we could ask those before we send Derek off.
Yeah, thank you. I saw the post-poll survey, but I couldn't vote, so I was hoping to boost my
Because you're
rate.
the experts.
Yeah, no, I was going to boost my rating a little bit. So
we have voters here too. So on the back of Lauren's poll, we also have Derek's poll, and that's how Family Shade's able to pull in more information. It helps us to find out what kind of trainings we need to do in the future. Midra mentioned this is kind of just like a taste. We got to do a longer training with Derek earlier in the year. Lauren is always wonderful and willing to come back, but this is a real opportunity for us to say, ooh, families want to hear more, they want to know more. So don't worry, Derek, your ratings are high in our book.
Yeah, thank you. No, it's a really important topic, and we're trying, it's a national topic, and we're trying to do better, in the sickle cell space, and we were able to get a grant for transition, and we're trying to work with our clinicians to see how we can do what we can on the community side to work with the clinicians. 'Cause I think it's really important to have that partnership between the patient community and the clinicians. It really has to be a partnership to make it effective and work well.
Yeah. No, absolutely. And something that's also really great when you're talking about the partnerships with practitioners is something that we got to talk about in our last Scott transition meeting was for the kids that don't always have families that are there to support them through the transition. So
Yep,
for our foster youth, for our underhoused youth, this is a really great opportunity when we're sharing it with practitioners that they're able to come through when there isn't necessarily like a family structure that's there to support other kids that are going through this transition. So really great.
Excellent point. Mm-hmm.
Mary, did we have any questions? Okay.
All right.
Oh,
well, thank you guys.
That's me. Derek, thank you so much for coming and attending. Really great.
Thank you so much, guys. I wish I could stay for the whole event, but I have some other commitments. So, but thank you so much. It's such an important topic, and I'm assuming it's being recorded. So I want to try and take a listen. I'm particularly interested in hearing about the role of the transition coordinators that you guys are doing later. So thank you so much for doing this, and thank you for having me.
Yeah.
Have a great rest of the conference, guys.
Thank you, thank you.
Okay,
and Derek mentioned something really great. So both PIC and Family Shade record all of their events. So this will be recorded, and we'll be able to share it in the next few weeks on our website and on YouTube. So for our in-person attendees, we're going to take a short break. There are some refreshments over there. Please dive into the cookies. And then for everyone that is at home, also dive into your own cookies. But we will be back in about 10 minutes. So thank you so much. I'm sorry, they were out of coffee. I didn't know that was a possibility, but water is available instead. So Kathy, because Tina's not able to make it, how does it go from here? I was gonna pull that table over for the two of you, but it's just you right now. So we'll go through the same questions, and then as an opportunity for anyone that's here to like ask questions or hear about your experience, and then people that are there. But I wanted to know, would you still feel comfortable sitting up at a table by yourself, or would you like us to turn it around? Or okay, awesome. Just for any child. So, were you able to see like how far away I looked from up there?
Yeah.
Okay. That's okay. It shouldn't zoom in too much. Like it won't zoom in too much. But I'm gonna pull the table over so that you've got a space. So just what I shared in the email, but what I'll go through is just kind of like understand how you really tell about yourself and your experience with transition for your children.
Because I'm interested and I broke it into like different topics, so I didn't.
So, would you mind if I just took a peek? Because what I can do is,
Kid perspective, electronics,
okay.
face to face.
So I actually really love that. What I can do is start with saying like, hey Kathy, can you like tell us about yourself and your story? So just like who you are and what your experience with transition has been so far. And then if you're okay, what I can ask is like, does your child have any like thing to share on his perspective with transition? And then are you okay with that? And I can kind of riff with that. And then face to face. And then everyone that's in person, so the polls we're taking online are the same pre and post that you have. If at the end before you leave, if you could just take out your pre and post test, you can just leave it where it lays, and I'll pick it up afterwards. Don't worry, there's not a pre and post for the parent panel. This is just an opportunity to lean in. Oh, yeah.
So I think.
I will change the same thing.
And I printed out like 30 of them. So we're about to get started, but what I'm gonna lay out next is just the event evaluation. Nonprofits are always seeking information. What we're asking is just fill it out to the best of your ability. If you've got any questions, please put them on there. If there's anything else that you're looking for, I mentioned Family Shade and the Parent Information Center are always doing training, always offering educational opportunities. So please don't hesitate. They are anonymous, but if you want to put your information on there because you're looking for follow-up or any additional feedback from us, or there's maybe a topic that you'd like to see, please let me know. And then we will go ahead and get started. I'm gonna pull up the bio for our next presenter. Still sharing. Oh, okay.
Or is this for people that are here?
Okay, so our next presentation is our parent panel. This is an opportunity for us to lean in to hear what some of our parents are experiencing and feeling. We have one parent with us today, the other one was not able to make it. But in saying that, this is also an opportunity, right, for any parents that are in the room, both in person and virtually, to also speak up if you've got any questions, if there are any thoughts that you want to share. This group today is parents and professionals, and it's an opportunity for us to share and, like I said, really lean into the experiences of the people that are experiencing. So without any further ado, I want to introduce Kathy Moss. She is one of our FLN parents. Kathy is a parent of 2 boys, the younger whom has been diagnosed with conduct disorder, ADHD, and reactive attachment disorder. Orlando is now 20 and is doing very well in college. And a quote that can be heard from Kathy is, "Transition process continues." So we are going to ask Kathy about her experience, just a few questions, and Kathy's going to go through some really great information. And this is, thank you, Kathy. We always want to say thank you. We always like to hear from parents. I mean, Family Shade works now under the Parent Information Center, and really it is parent-centered and kid-centered information, right? It's kind of corny, but I'm going to put it out there, Major. I'm going to say it. So Kathy, I wanted to start. Would you be able to share a little bit about yourself and your experience with transition?
Sure. We ended up sending my son to a treatment facility when he was 14, and when he came back, he was 16, ready to drive, ready to experience young adulthood, really. And so I was almost like playing catch up with his healthcare transition. So a lot of what I'm going to share has been learned the hard way because I didn't know about the resources that were available. So I think that's where a lot of people watching this can really benefit from all these tremendous resources that you have.
Yeah. So in mentioning that, you said you were kind of playing catch up. And now knowing that the resources that are available, what is maybe something that you would like to share that you haven't heard about so far for any parents that are either building up to or going through this experience right now?
Well, I've had a couple of sections in my notes here, and one of them is electronics. And this is my first time wearing glasses, so they'll probably fall off my.
They look great.
A couple hundred times. But the electronics thing, I found that my son like I was leaving him sticky notes about when his appointments were, and he would lose the sticky note. And I finally realized that he doesn't respond to things like that. His method is texting. So whatever your child is into, like if it's the iPad or the cell phone texting or email, just kind of go with that. Like even if you have a medical home, like the binder, they might not respond to that so well. So maybe it's important to get all the information on the electronics. I found that apps are helpful. There's an app called Round Health that it can put in all your medication information, and it gives you reminders of when you need to take a medicine.
I love
It's
that.
great.
What's that called? I'm sorry.
Yeah, share
It's
that
called
out.
Round Health, ROUND Health. But there are tons of apps out there, and maybe your kid could get involved with selecting their own apps for things like that. I would also suggest that they set up, you can help them set up their phone where all the information about their medical needs is under one letter, like whether it's doctor or medical, and then list them all, because sometimes you forget like what the specialist's name is. I would have the phone number, the hours of their operation, their complete address, and that can link to the maps. So they have all that information there, and you're not scrambling at the last minute. Also, to have all their, I suggest taking a screenshot when you go into the doctor's office and you have to fill out the form. My son kept asking me over and over, what's the emergency contact name, or what shots did I have? If you take a picture of that and have them keep that somewhere safe on their phone so that they have that and they don't need to be asking you.
Yeah, I love that, actually. That's something that I did for a very long time because I didn't know any of those things, and I was constantly like, what number is this? Who do I call? What is this about? And right now if you're putting anything on your phone, you can also lock an image. So if somebody ever were to pick up your kiddo's phone or your young adult's phone, you could make sure that that information is locked so that they would have to put a passcode in, and so that they're the only ones that can see it, or you and them are the only ones. And that way, if you're like me and you are constantly leaving your phone places, nobody can get that information. So that's a really good one. I like that.
And then also, there are a lot of labs and hospitals and doctors' offices that have online, you can like have your own account online and you can ask them questions without having to go into the office. The LabCorp has a complete list of all your results of all the labs you've ever done there. And so it's helpful if your child can tap into that.
So Kathy, I know in your notes you were mentioning there was something else that wasn't shared, and you wanted to talk a little bit about kind of like the finances.
Yeah, the HIPAA thing is tricky because once they turn 18, and if they choose to sign that form, you don't have access. So a lot of times you're still footing bill, but you can't even talk about bill. And then each facility has their own thing. It's on their website and it's hard to find, or your child doesn't like follow through with it, and it just gets to be like very messy. So so you might want to have that talk with your child before they turn 18. Maybe they will allow you to have medical access if you agree not to check in it, but then you have to honor that commitment to them. So it just depends on what kind of relationship you have with them. And then like for actual payment, some places insist on a copay right at the time of the visit. So I would give my son my credit card, but I felt uncomfortable with that. So you might want to think about that and come up with a plan ahead of time for that. And then also like to decide how you want to handle the medical aspect. For example, like my son had surgery and he qualified for 30 physical therapy appointments. He did not need all those, but in his mind, he had to follow through with all 30, which became really expensive. So your child, you might want to still engage with your child on some aspects of their health care, even if they think they're an adult and they can handle it all. I mean, as long as you're still paying the bills, then you should have a say in certain things.
So you were mentioning how hard it can be sometimes in that dynamic of like an adult that feels like they're an adult, but a parent that's still involved. Would it be okay if I asked how's that been emotionally?
Well, as a parent of any, especially with a child with extra needs, it's hard to know because day by day, it's like you don't really realize they're getting older and more capable of doing things. So it's, it'll slap you in the face one day about something. But I asked my son for feedback, and he gave me this really long text, but the gist of it was I'll read you a section of it. It says having the parents step back and not being so on top, even when they think they should, would help the kids to start taking responsibility and learning how to schedule their own things. Even talking on the phone with the doctor would help allow the kids to learn to be more comfortable talking with people. And that's one of the things I find with young people nowadays. Face to face is really hard for them, and sometimes it's scary. It makes them nervous. They're afraid somebody's going to ask them a question and they don't know how to answer it. So they would prefer that hands-off kind of thing. But on the other hand, a lot of doctors nowadays, they will do texting. So, you might want to have your child find out from whatever office they're going to, like how they can communicate.
Mm-hmm.
So, I guess that didn't answer your question.
No, that's great.
Put a little bit in here right now because of the electronic things is such a big thing. And my granddaughter is 19 years old. And the day she turned 18, if I had to hear, but I'm 18, Nana, and she would say that all the time. But yet, when it came to things, most of the things, she would just say, you do it, Nana, you talk for me, Nana, But I say, but you're 18. And then she just gets mad at me if I bring it back on her.
Mm-hmm.
I mean, that's it. However, she does text me all day long from school. Math is hard. Try your best, So I wasn't responding for a while. I said, you just need to concentrate. She went on Instagram and then started messaging me from Instagram because I wasn't answering her on text. Now, I don't even use my Instagram. I didn't even know I had an Instagram account. To tell you the truth. I probably started it one time to figure out what it was. When I went answer on that, because I'm not on Instagram, she set up a Remind account and started texting me on Remind because I wasn't answering her on.
She's persistent.
So
that's a strength sometimes.
Yeah, and she can, communicate that way. She's very poor, language skills, and everything's, it's not written with periods and exclamation points and capital letters and all that kind of stuff, but that's how she communicates. We went to the doctor at AI, and there was a resident, and he was a male, and she was going to talk when she went to the doctor. She was ready. We talked about it. What are you going to say? We practiced. She went in. A male resident came in. She doesn't react well to males. She shut down. Now, eventually, he got her to talk to her, but, and I forgot when I was talking about this earlier, she says, can I write it?
Mm-hmm.
And, the doctor said yes. So that's what she ended up doing. She ended up on her phone typing what she wanted to say and then showing it to the doctors.
Mm-hmm.
So I think that's where we are. And as much as I can say, well, electronics are very dangerous. You have to be careful about what's going on. I mean, the things that have happened in my own house with age and everything. But it is the way of the world. It is. And that's, unfortunately, that's how they're going to communicate. So you can try to get them to write on a piece of paper or to read a piece of paper, but that's not the way the world is to them. So you're right about the electronics. And like I say, Paige is persistent about communicating, but she will do it electronically.
And interestingly, I don't know if all doctors do this, but our doctor, if you set up an account with it's Christiana Care Health Services or something.
It's a portal, right?
It's a portal.
Yeah.
The portal. It's very specific. They tell you exactly what you talked about. They tell you what your follow-up responsibilities are.
Mm-hmm.
It's great. And then you can ask 10 questions on that, and you don't have to go back.
Yeah. I will
And
speak.
AI has the
I was gonna say.
too.
Mhm.
And it's funny because when she turned 18, all of a sudden mine disappeared. And then she had to, I said, she wanted me to continue doing what I was doing. And I needed to do it too, for my own knowledge. And so she had to say it was okay for me to get it. But just recently, they took away some of the stuff. I can see certain things, but I can't see everything.
Okay.
So I'm not quite sure what, I haven't figured it out what it is. So, but I do. If you're worried about that, you think that medicine is making your belly ill, you need to go online on the Moors and talk to your doctor. Find your doctor, make sure it's the right doctor, and then say what you think. And then the doctor will respond to you. And you know what she said to me? I don't have enough space on my phone to keep the Nemours app on it. So the Nemours app is not a priority.
Maybe once she takes off TikTok, she'll have.
Yeah, that's it, yeah. So, yeah, I just have, so you'll have to do it now.
Mhm.
I said, well, I can't do it anymore. They took that away from me. Just pretend you're me. Oh, no. Are you the one that tells me don't lie now?
Oh.
Don't pretend you're me,
Mhm.
you know?
She's on top of everything.
Yeah, she is, so,
Well,
yeah.
if you guys remember in Derek's presentation and in your like HCT checklist, it talked about that transition from like parent role to child role.
Yeah.
And it's like you guys get to a point when they're older and you become like consultant, or you're kind of like the advocate that is consulting with them and supporting with them. It sounds like that has been quite the experience. Is there anything that you would suggest to a parent that is moving into that consultant role, that is starting to have to kind of give up the reins?
Yeah, when you walk into your appointment or their appointment, have them put their phone away and listen to the interaction with the desk person. Get out your IDs. Here's the form. You fill out the form. I'll sit by you, but you fill it out. When we go in there, you're empowered to ask questions, things like that, and then also to tell them stuff that you have learned. For example, my son used to get very frustrated, like, you have to schedule it between my baseball and my school and my work. You can schedule it Tuesday mornings. It's like, well, maybe the doctor has surgery days. Their office closes at 11 on Fridays. A specialist might not see you for 6 months. So if you set the expectation with your child ahead of time that the doctor has a schedule too, it allows for less frustration on your child's end.
Yeah.
I think another thing you have to look at is I have to look at my own behaviors and because I was at the transition period I signed here, and it's like, boy, I have a lot of work to do on me. Is what I do. Because we'll talk about when we go to AI, have your ID, go in, check in, and she says she's going to do it. And we get in there, and then she just says, Daddy, you do it. And she goes like that, and I jump, and I do it. Not good.
That's tough though, right? Because you also, even though she is moving to adult, you also are moving to taking the backseat. So you guys have both been very comfortable with the roles that you've had for the last 18 years? So it makes sense that there has to be kind of like that learning curve, right? That was some of what you were talking about, Kathy, is it takes time to really transition for yourselves as well, to kind of be a little bit more comfortable with letting that go and what that means for you now.
If I could give any advice to anybody, I would say start much, much earlier.
Mm-hmm.
Because, and they're children, and you have that, parent, I want to help, and they have special needs. But the truth is, I keep thinking you should have done it at 14. You should have had her check in at AI for an appointment when she was at least 14. That's when you should have done it. Okay. So by now she'd be ready,
And that was some of what Lauren was talking about, right?
Yes.
What their program is doing. But something that we talk about often is you do the best with what you can, with what you have, right? And so it's like you might have wished now that you could have done that at 14, but you're working with the age that you're at, and it's not too late though, because there's still time for you to be able to walk through that process and to find these resources. And, like you've got today, you've got the time after you leave here to even just look over that. The time that you're doing right now is all a drop in the bucket for the good, and that's something that's really beneficial.
Yes.
So
and there's no age limit, really.
Yeah.
I mean, there's no deadline on
No.
you have to do it by 21 or.
There's not.
I will say
I will say, in my experience, you said you should have started early. I agree too. I take care of my brother who is now 19, and I was so focused on the school transitions. I really didn't start because he has a lot of, complex medical needs. Not very complex, but for him, to manage it, he just didn't want. So I just took it. But now he's 19 and we have the school transitions out the way. And now I'm teaching him about the medical piece. So, at your own pace, one thing at a time. I wouldn't say that, it's not too late to start those things. I guess you have to prioritize what, is most important at that point, because transition in the whole is very big. And we were just talking about this at the cadre meeting where, we're not starting these conversations right at 13 or 14. We're actually starting these conversations at 15 or 17 when they're about to graduate. And at that point, they're shoving everything at you. So we do have to start those conversations earlier about transition as a whole. But if we weren't sitting in this room when I say transition to you guys, what would you think? You wouldn't know, right? You would think it's like it has something to do with educational transitions, but we don't necessarily think about the healthcare piece of it, or the post high school, like the college, the independent living. Like when you say transition to someone, especially a parent that is new to this, so they're learning as they're going. And it depends on where they start and who they start with is as the information they receive from that person. And they may only be giving them a piece of the
That's what I'm
transition
finding out
process.
now, and sometimes I'm getting conflicting information about different things, which just threw me. I've been going through this for the last couple of weeks, and it's school transitions, and it's like, whoa, did I miss that? I missed the boat on that one. I should have been doing that last year, and then COVID was also a barrier at that point too, because nothing was being done then. And then when you went back to the schools were in such turmoil at that point. It was very difficult for them. So I was like, well, you told me that, and then I figured, oh, you told me that, and that's like almost opposite. So I'm trying to clarify, what really is the right information.
Right.
I also find that I feel overwhelmed with the choices, with no guidance. So what from support services for supportive employment and job coaching. Okay, so here's the agencies. Excuse me? This is the list. Well, which site would be better for her? You need to call. Really? So I got someone to limit it to 3. The first one doesn't do supportive employment. The second one has another business that I think some of the clients are being filtered into that wouldn't be appropriate for. Okay? And the third one, we did go, me and my daughter went down to visit, and my granddaughter's going to go spend some hours there and see what that's like. Except that it's in Middletown and we're in Newcastle. I didn't even know what I'm doing. It's like,
That's hard.
so, but that's the thing, it's like, you know what is supposed to be happening, but then you're given this list. And that's why I went last night to the transition thing last night to try to narrow it down a little bit.
So
And
right,
there's a lot of marketing going on.
there's a lot of
marketing
sharing
going
and a
on,
lot of
yeah.
marketing. You, all three of you bring up something really great that we want to talk about next, is we talk a lot about this being the role of the parent or the partnership between the parent and the child, but today's event has like a 50-50 split of both parents and professionals. If there was something that you could share with a professional person or someone that's in the field like Lauren or Derek or, I mean, Mary is a dual role, but even the people that are in this room, what are something that you could share about your experience so far and saying like, you know, these are some of the things that I'm experiencing as a parent of a child that's going through the transition to adulthood. Help me. How can you dial in on some of the professionals that are here today? What's something that you would want them to hear from you?
I feel like they should be responsive. Like, for example, we went through a lot of trauma when my son was younger, and I wanted it on a record somewhere, just in case something happened where it would become like a legal issue. I told our primary care, or the pediatrician in private, and I was just shocked at the dumbfounded look I got, and they never mentioned it again. I was expecting them to be a little more, you know, helpful or something. I'm not really sure, but
Thoughtful.
And to this, I mean, he still goes to that pediatrician at 20, but I still feel like I don't know if they even heard us or think about it when they talk to him, you know, because he's still got a couple of issues. Or I guess like, and I also want to empower him that if he feels like he's not being treated appropriately or anything, that he has the power to switch doctors. But I guess in general, I would hope that they would listen more and sort of recognize your situation.
Sure.
And myself, and I during COVID, the community navigator we had for a while, and she was okay, but you know, it was not a lot for her to do, from my understanding. Left the agency, and then we got another one who lasted 1 week, and we got another one that I believe lasted about a month. I'm not sure. She contacted me once, not twice, so I figured she didn't go into the second month. And now we have one that I think is excellent, and I'm very, very happy about that. Okay, and this does not reflect on her because she's doing a very good job of communicating. However, some of the people that I have been in contact with don't understand that everything, even the vocabulary, is brand new to you. You know, sometimes when you've been doing it for a year, or 2 years, or 3 years, or 20 years, you say the word supportive employment, and you think everybody knows what that is. Or you say job coaching, and maybe just from the definition, you think the person that is hearing you or reading it knows what it is. I didn't. I had an idea of what it probably was, but I didn't know. So, and there are only 2 of the things that I've been dealing with in the last couple of weeks as to, please define that for me, you know? So I think you have to know. I always say I worked in early childhood education. And in the beginning of the year, I would, you know, have this beautiful curriculum around the ABCs, you know, and it would be A, and we would go visit Africa, and we would eat apples, and we would, you know, and it was the whole thing. And it was so much fun. I found out about the 4th year, the kids didn't seem to like it. And you know what it was? It was me. I didn't have the enthusiasm to go visit Africa anymore or to eat those different kinds of apples. So it was, you know, because it became rote. So I think that some of the people that may be in this profession for a while, there's a lot of burnout. COVID must have been horrible. And I think that a lot of it becomes rote. That they're just saying, okay, this is what I need to do with this person, the same that I did with this family, the same that I did with this family, without understanding to this family, it is brand new. Everything is brand new. So that is what I would tell anyone that works in really any profession, that the person in front of you doesn't know, doesn't have that knowledge that's in your brain, doesn't have the experience.
Absolutely. Oh, that's really great. I did, thank you, Mary. I wanted to go through some of the questions that might have been up here for any people that are in the chat that are asking some follow-up questions or just looking to know more from our parents. I actually can't see that, Mary. I drove here though, y'all, I'm fine.
It says, are there any resources or recommendations specific to non-speaking people that can help them be as independent as possible around, I guess, Social Security benefits and communication with healthcare professionals?
Any of the professionals in the room want to answer that before I ask our parents if they've had any experience with any of these? Lauren, are you familiar with any of these?
Yeah. Can they hear me?
Yeah.
Okay. I would say that however that person does communicate, whether it's an AAC or text to speech, or sometimes people write stuff down, however they communicate, build upon that to communicate with the healthcare professionals. And if you do need some assistance with communication stuff, you can always turn to Daddy or Easter Seals for some help with communication type of resources.
And
But it's really specific to the person and how they communicate.
we actually, Andrea, I see that, and I know we've been back and forth in email a little bit, but Family Shade did a training on visual communication devices that can be used during specifically healthcare visits. So I can send you a link to that, as well as the slides that they sent us. But they went through something really great that was like assistive technology that could be printed out and put into that medical home binder that you were talking about, Kathy, or even added to like a communication device that your child or young adult already uses. And it specifically was for healthcare interactions, going to the dentist, going to the doctor. I think they even had one that was like going to the OBGYN, all things that sometimes get overlooked for a child or a young adult or, you know, an older adult that is non-speaking but still goes to these visits and is trying to play an active role. So Andrea, I can send you that. I'm just going to make a note of that, not a mental one, because it needs to be a real note, but we do have some information on that. So thank you, Lauren. That was really a great share, and I'll share that. And that piece from our training was from DNEA. They shared that with us. So I can share that with you as well, Andrea.
Can you send it to me too?
Yeah, absolutely. Does Bay Health have a program like Christiana to help with transition to adult healthcare?
No, not really. So, like, are you talking about the Center for Special Healthcare Needs? So that's really unique to the state, and that's why people come from all over the state to the center and do travel. However, there are some doctors, adult doctors at Bay Health who we do recommend and do well with young adults with complex needs. I don't know them off the top of my head, but my information is in the slides. So if you want to email me, I can send those to you.
Do you do anything remotely?
So the center, the Adult Center for Special Healthcare Needs, they do telehealth. So you don't have to schlep up every single time, because I know they had people who come from like Del Mar, like people come from other states. It's unique, all the services that they have. So people really do travel for it.
We're just gonna give 1 second, I think. I think that she's visual communications.
As you're pulling that up, I just wanted to make a note. Lauren mentioned Daddy, which is the Delaware Assistive Technology Initiative, and there's a link in her presentation as well that can take families to that resource or participants to that resource. And we'll make sure that we include that link in the chat as well, since it was mentioned. I just wanted to make sure everyone knew the acronym.
Okay.
And that is a resource that was provided, that's been provided to them.
Okay.
And
Thank you.
Daddy is in all 3 counties.
Yes.
Oh, okay, that's great. That's even better. PIC serves all 3 counties, the entire state. And just a reminder, I will send out all of today's presentations to all of our attendees after this. So you should receive that later today.
I will say too, so I had a parent who was not speaking. And this was, you know, I was little when he first lost his ability to speak, and technology has come just leaps and bounds over the years. And he was able to, even as long ago as like the late 90s, he was able to fully navigate a medical appointment on his own through his assistive technology. And the technology today has gone so much further. We kind of look at it now and are like, oh wow, this is, he would have loved doing this, or he would have loved using this. And so there is technology that can really, really make that easy to navigate for a person who doesn't speak.
And I would think this transition time is a perfect time when you're selecting your adult caregivers, or medical people.
Yeah.
To, like, maybe the parent could make the call and say, this is what's going on. Are you receptive to that? Because some doctors, I don't think really are.
And that's been your experience. I think as you move from that role to like advocate or consultant for your child, like that is an opportunity to say, like, let's talk through this. Is this something that you're comfortable with at your doctor's appointments? So that they feel really empowered when they go into that. This has all been really, really great. Before we end, I don't see that there are any more questions, but is there one thing in your journey that you would just like to share as like a closing, Kathy?
I would just say, the thing that comes to mind is like work with your child's temperament. Like if they have any kind of attention span thing, say something 3, 4, 5 times, however long it takes for them to say, I got it, okay. And then also, I lost my train of thought. If my son was the least bit hangry or busy or tired, even if I was trying to be helpful, I would just get pushback or irritation. So I had to figure out like when was a great time to talk to him about this stuff so he could absorb it better. So just be like kind of in tune with your kids' particularities, I guess.
No, I think that's great. And something that we talked a little bit about in the last transition training is just that, like playing to your strengths. Everyone is an asset, right? We've got all sorts of people that are out here supporting and advocating for each other. And just that kind of like temperament that you talk about, making sure that your child knows that they're an asset and that they're a large role in this. It's all about them. If they weren't here, like none of us would be here. And that's really important. And so knowing, we've talked about this, but like I would feel really uncomfortable that younger, but now I'm an adult and I'm like, don't tell me, I need you to show me. I really need you to see me, because whatever you come into this room thinking about me, let it go. I'm here for this appointment, but I need you to show me. For how I work and for my disability, that's really the only way that we're going to get out of this appointment. And I used to feel a sort of way about that, but exactly what you're talking about, like letting them feel empowered and making sure that they do feel empowered, because at the end of the day, if it weren't for our kids, none of us would be here. We wouldn't be in this meeting. Like there would be no point, right? And that's something that's really important. Margot, you've had a lot to share, so thank you. Is there anything that you think or that you would like to say, just kind of as like a last thought?
I agree with her so much too.
Yeah.
But you have to also, again, I reflect on myself, is the patience that is required. And you said some of the things that may be challenging for you. Well, my granddaughter, she needs to know what the schedule is. So before she goes to bed at night, it's like, this is what we do, this is what we do, this is what we do, this is what we're having for dinner. Okay. Now we have alarms go off. You get up at 5:30, 6:15, you have to be done breakfast because it's time to brush your hair. Now this is every morning, and then the alarm goes off because you have to open the door because the bus is coming. So, but you have to do this every morning. And then she'll get to school and she'll text me and she'll say, what's for dinner? And so I go, oh man, didn't we just do that last night and this morning? And then when she comes home from school, she'll sit down and she'll say, what's for dinner? And it's like, you have to realize this is your life. This is how it's going to be. This is how she communicates. This is a need that she has. But sometimes it's like, oh, don't you remember? So sometimes I will say, oh, can you remember what I told you? And then she'll tell me back. So it's just, sometimes it's just a need, and you have to recognize that. So it's a lot of patience with that kind. You have to really, again, look at the child, and that's, as a human being, that's what you would expect from anybody else that is in your life and that loves you. We all have our particulars and our idiosyncrasies and things like that.
Yeah.
So,
and there's so much trust that comes with love, and right, your children trust in you to ask you those silly questions like throughout the day because they know that they'll get a response. Or right. Sometimes we lash out at the people that we trust the most because we know that we can do that to them because we trust them and they love us back. And so in that role, right, as a parent, it's such a big thing to take on. And so while I thank both of you, it's a perfect opportunity for me to say that our next person coming up is specifically from the Parent Information Center because, right, there's a partnership between you and your child when they transition to adulthood, but it's not something that you necessarily have to do all by yourself. There will be times where you have to walk alone, but then there are times where you can come in and walk with someone like Lauren if you're using their program, or you come back and you reach out to Got Transitions and you talk to Derek or Becky, who wasn't here today. But there's also an opportunity for you to be supported and really for your child to be supported through some of these roles and some of these transitions, whether it be medical or educational. And so thank you, Kathy, and thank you, Margot, but I'm going to welcome up.
Before you do that, I just, so there's a couple comments in there.
Oh, okay.
Andrea, yes. So, still, I would reach out to Daddy too, because when you think of assistive technology, that you think of a device, a technology device, correct? But they do other things. So it was explained to me by someone that came out to do an assessment that they will work with you to fit your needs. So if that is creating something that goes on the end of a pencil to help a student, they will do that. So that could be something that you work with Daddy on getting so that your son can take those to the doctors with him or the school or wherever. And that can be his way of communicating. And like the parents just shared, you might have to teach them, the doctor's office, how to use those, but at least he will know. And then he will still be able to communicate.
And just real quick for the purposes of the captions, because I laugh every time it says daddy.
Yeah.
So this, I'm gonna spell it out. That is D-A.
Yeah, it's in the chat.
T-I. Still not coming up right.
And then one last thing. Before we welcome up Suzanne, I wanted to say, Christine, that's a really great one for anybody that was listening in when we were talking about like using technology and using your phones. A shared calendar, that's what we do in our family.
Yep.
Like that, listen, that works. I think that that's a really great one. So thank you for mentioning that. And you can use your shared calendar when you make an appointment with a member of PIC. So we're going to welcome Suzanne up, and she is going to talk about some of the PIC programs and how to dial in on those almost as a call to action. You've heard some really great snippets of Lauren's program and of Got Transition and what our parents are experiencing and what you may be experiencing. And it's an opportunity now to see how we as the Parent Information Center and Family Shade can offer you some support.
Mary, I'm going to apologize. There are some animations in mine, so we'll bear with me. So just real quick, I'm going to introduce myself. My name is Suzanne Ferris, and I am the Associate Director here at PIC. Kelly Minogue is our transition coordinator, and she, unfortunately, for today's schedule, is on her way to North Carolina for a little weekend trip that they had planned. So I'm filling in for her today. But just a little background on me. So I am the parent to 4 biological children, 2 stepchildren. All 4 of my biological children have different medical complexities. So life in our house has always been a little interesting. And they range in age now from 23 down to 13. So we are living transition in every stage right now in real time. So I'm gonna, yeah. Oh, you're my favorite. Awesome. Okay, I have my scripts because I will go off and talk forever if I'm allowed to. So I want to thank you for being here today. I'm going to go ahead and skip. Oh, wait. There we go. Okay. So now I'm getting all my technology ready. I'm going to have to, because I have my notes on here. All right. So I think at this point today, we have defined transition over and over and over, right? But yeah. So transition, technically defined, is the purposeful planned movement of adolescents and young adults with chronic physical and medical conditions from child-centered to adult-oriented healthcare system. We're also talking about education and just life in general, right? And that looks different for every family. Some youth are going to become independent very early on. Some might become independent with a little more assistance, and some are going to stay needing help for the rest of their lives. And so the question is, and what I'm going to kind of talk about today is us as parents and how we navigate those with our children and support our children, but also in our own experience, because it's a transition for everyone, right? We talk a lot about the child's transition. Parents are transitioning too, right? So what does this process look like? If we're being purposeful and planning, where do we start? There is an official technical answer. Does anybody know what the technical definition? I downloaded this from Got Transition yesterday. What is the technical answer for when we start transition? There's a number. 18. 18? No?
Birth.
That is the real answer. So the Got Transition answer is 12 to 13, right? But you're right. The answer is birth. And I will tell you in my experience. So my oldest has osteogenesis imperfecta. And so we knew by the time she was 2 years old, that her life was going to be difficult. But we had no idea what that meant. And with my first one, navigating that was me stumbling through all kinds of things. And I messed it up. I feel guilty. I messed it up every different way that I could, right? And I know that was me learning, and we were learning together. And I had to let go of a lot of things as she started to get older. I did not think that we had to start transition at birth or at 12 to 13. About a week before she turned 18, I went, oh my gosh, she's going to be an adult in a week, right? And we'll talk about that a little bit
You're
more.
making me feel good.
Oh, good. Well, if I can make you feel good today, then that's what I'm here for. So these are the keys, and unfortunately the caption is going to cut it off a little bit, but here are the keys that Got Transition gives us for this stage. And those are to help your child learn about their diagnosis. So I talk to a lot of people in some of the groups that I belong to about when to tell a child about their diagnosis. I did not realize that this was a thing. I just didn't, because from my experience, I never thought to not share with them what their diagnoses were. But a lot of families do not tell their child that they have these complex diagnoses or any diagnosis. I talked to one woman a few weeks ago whose child has epilepsy, and you would think, well, that's obvious, right? Their child does not know. Their child is 15 years old and does not know what epilepsy is, does not understand the implications. With my daughter and her OI, her particular type of OI, she broke bones until she hit puberty, and then she stopped. Nobody told us, and I didn't research, I didn't know. They just said she'll break bones for a while, she'll be okay. Nobody told us that after she hit puberty, her collagen was going to start to deteriorate, and she's eventually going to lose her hearing. And she's going to be in more and more pain as she goes on because she loses flexibility in her body. I didn't know that. No one told me that. The doctor said, here's your diagnosis. We're going to put a note in your file so they don't call CPS on you. And let us know if you need anything. That was 20 plus years ago at an Army hospital in Georgia. And it wasn't until she was 15 and she started having this unbearable joint pain and we went to AI that we started to really learn about her diagnosis. So that was my experience with my first child. My second child, I started getting a little bit better. But so this is where we need to support them in being self-advocates, right? And becoming self-advocates. So my youngest is now 13. And she has epilepsy and autism, a muscular disorder, and ADHD and anxiety and depression, and I'm going to forget all the others because there's just a lot. So we spend a lot of time right now. She loves to research. These kids love the internet. They love to research. She is online every day telling me that this new symptom might mean she has this thing. That can be good and it can be bad, right? Because I'm constantly calling the doctor like, can you explain to her that no, she's not having a stroke today? It happens, but it's time to support them in that learning, because even as adults, we see this, Google Doctor thing. Our kids know how to navigate the internet. So helping them to learn about their diagnosis, supporting them to become advocates for themselves, to be able to talk about, oh, this is what's wrong with me today, is very, very important. My 17-year-old struggles with this. And so I have to go with her to the doctor even now at 17. And I probably will continue to have to do that for a while because she has what used to be called selective mutism. There's a new term for it, but she will freeze in a situation. And those of you that know Shelby, that is one of her official diagnoses. If she's prepared, she can talk. But if she's going into the doctor, So we're working on that with her. My youngest, she'll walk in and tell them, I need you to test me for this, and I need you to test me for this, and I want to know what my results were from the thing we did last time. All of our kiddos are different. And the biggest thing about transition, starting from birth, starting from age 12 to 13, is building that relationship with our own children and just letting them know that it's okay to have questions. It is okay to ask for help. And it's okay that if they're not quite ready to do it on their own. We'll get there when they're ready. This is also a time to start talking to your providers about how long they can continue to see them, right? So some providers are done at 18, period. That's it. My oldest could still technically go to Nemours because the specialist in osteogenesis imperfecta will see them up to, I think it's 26. It just depends on the doctor. With my 17-year-old, who we're now in like the full year ready for her to like be an adult, half of her doctors won't see her now because she's too old. Half of her doctors are like, no, we can't see you until you're 18 in 6 months. And so we didn't navigate that the way I'm now navigating it with my 13-year-old and figuring it out in advance. So starting at age 12 to 13, start asking your providers that question. And the final point that I make in this slide is to be a safe space for your child, or for the child that you are helping navigate this. Puberty hits all children, regardless of their disability or their diagnosis. And sometimes we forget that, right? We navigate these things all the time, but we forget that our kids are navigating things. The neurotypical, the normal things still happen to our kiddos. So we need to be their safe space and let them ask those questions. Tell us when they are confused, tell us when they're concerned, tell us when their friends are saying things, because trust me, if you're not telling them, people are. And unfortunately, especially with our kiddos who have developmental disabilities, those kids in the high school, in the middle school, they're not going to stop telling them things because they have a developmental disability. They're, in some cases, going to tell them more because those people do exist. And so if we're not preparing our children for that, we're going to have a problem later on. Okay, so the next stage on our transition timeline, age 14 to 15. This is when the transition planning is mandated in the IEP, right? So we have to start planning for what comes after high school. And even the end of high school is different for some kids because some kids have the extended program. But this is where we really need to start working with our kiddos, working with our teens, because they're now teens, about what's coming next. Students should participate in their IEP meetings, in their 504 meetings. Just as we talked about, they need to know their diagnosis. They need to be a part of planning for their future. I'm always surprised when teachers are like, why do you have my 12-year-old goes, or my 13-year-old goes to her IEP meetings, her 504 meetings. She wants to be there. In fact, we had a 504 meeting this year, and somehow we started talking, and it was virtual. We started talking, we were done, and I went, oh gosh, we never had Lily come in. We had to redo it because Lily was like, I'm not having this. We're going to have this meeting is about me. I will be there. And she's right. I was wrong. She was right in that situation. They should be participating. This is also when you start looking at what your child's goals are, right? Get my other slide here. Explore their interests. So my son is now 21. When he was this age, we were told he wasn't going anywhere. He was going to maybe get a supported employment or maybe go to trade school or maybe, but they didn't think even that was going to happen, right? We started working with him and I sat him down one day and I said, what do you want to do? Like, we've told you all the things that we think you might do, and your teachers have told you all the things you can't do. What do you want to do? And he said, Mom, I want to go to college and I want to be an occupational therapist because I loved my occupational therapist and I want to do that for other people. And I had to have a real good, I went and had a real good cry that night because I'm thinking, there's no way. We can't do this. He can't do this. They told us he can't do this. He's graduating in a month with his degree, not in occupational therapy, but he went to a 4-year college away from home, 8 hours away from home, God help me, was a recruited athlete. He does TED Talks. He's all over the place. Because when he was 14, we sat down and said, what do you want to do? And then we worked with transition coordinators and we worked with social workers and we worked with doctors and therapists and we made it happen. So the only limitations that we put on kids are the ones that we put on kids. If we're talking to them and finding out what they want to do, they might not, if your kid comes to you and says, I want to be president, that might not happen. That might not be out. But where can we go in that direction? How far can we make it in that direction? The only thing you lose by not trying is not trying. You lose that opportunity. So Finally, here's where we start building skills in problem solving, decision making, independent living, and self advocacy. Same child, my son, when he was 14 or 15 and said, I want to go away to college, I don't want to be in Delaware. We said, okay, well, you got to be able to go to the grocery store, and you got to be able to, go to the nurse when you need help and go navigate the dining hall. And so we started practicing these things. We went down to Salisbury University, which is where I graduated, and we went through the dining hall and we would practice like once every few months, just see what it's like. Do you like it here? We started touring colleges to see, is this going to work for you? We started working with transition coordinators at colleges and with his OT and everybody else. We started practicing. One time I sent him to the grocery store with $20 and I said, go cook dinner for 4 people. And he made it happen. It was a mess, but he made it happen. Like, it took a while, but he made it happen. Sometimes, kids, they'll surprise you. I say kids, our teens, they'll surprise you. And the only thing, you just try and help them, support them in what they want. Because ultimately this is their life. We are their support people. We're their, we help them navigate, but this is their life. And that can be really hard for us as parents and caregivers too, right? Because this is the age where I started to realize, wow, they really are going to leave home. And I'm not going to know what to do with that. And there was a lot of feelings that came with that. And that's okay. So working with a transition coordinator, working with, therapists or psychologists or whatever, find help for yourself too. Get that support that you need to be able to help your child navigate. Because there are going to be days that you think you're going in this direction and you're going to hit a roadblock and it's going to hurt you, right? It is when somebody tells you your child can't, that hurts. That is a wound to your soul, and you need to be able to navigate that for yourself. Because if you can't navigate for yourself, what do they tell you on the airplane? Put on your mask first, right? You've got to get okay with this to be able to support them. All right. All right. So next up, I'm trying to move really quick because I don't have a ton of time. And I will talk forever. You can ask me, anybody. So 16 to 17, this is where kids can drive, if they can drive. And that is a big eye opener, right? And pun intended, this is where we need to let our kids start driving. Whether they're physically behind an actual wheel or they're just driving their own course in life, we've got to start letting them do it. I will say, so when my son was getting his driver's license, nobody told me that children with autism have increased incidence of certain traffic violations and certain more instances of accidents. I know now. In fact, my son is actually was part of a study on this now because he totaled 2 cars within the first 8 months he was driving. And that was the point where I went, okay, this might be something to do with his autism. Let's call his OT and maybe talk this through. Never thought about that. You can actually get occupational therapy to help you navigate learning to drive safely, right? And there's research being done. There's some trainings that are coming out now about helping children with autism navigate driving. I'm not going to go into all the research, but there's research out there if you want to Google it. So, and he is fine, thank goodness. We did not have to get the call that he was hurt or that someone else was hurt, and we can replace the car. He was fine, but it certainly opened my eyes. And he and I had to have a long talk about okay, now we know. So what do we do to fix this? And these things happen in life, right? So how do we navigate this? They may not drive, so explore transition options or transportation options. Sorry. In Delaware we have DART, but DART doesn't go everywhere. If you're in Wilmington and you can access, more transit, that's great. If they are going to need to know Uber or Lyft, help them learn how to navigate that. Help them figure out the transportation options that they have. Work or volunteer experiences that match their goals. My son, when he said he wanted to be an occupational therapist, we called his childhood occupational therapist and said, hey, do you have a volunteer program? And he did. He spent 2 weeks there volunteering and loved it, loved every minute of it. In fact, they said he taught them a few things because he would say, well, when I was here, I learned this, but this is my experience. And it was great for him. And he started to see that maybe that wasn't what he wanted to do, but at least he had tried it, right? Be realistic, proactive about driving. Talk about sex. I talked about this in the last one. Talked about this. You're going to hear this from me in every presentation. These kids are going to hear about it. They're going to see it. It's going to be on TV. It's going to be in the hallways. It's going to be everywhere. Talk to them. Make sure that they are safe, right? Because it is so easy for anyone to get taken advantage of But for kiddos with developmental disabilities or other disabilities, they come with things like anxiety and depression and self-esteem concerns, and that all makes them at risk for being taken advantage of. So talk to them about sex, continue to be their safe space to ask questions, to explore topics. And finally, this is where we're going to start supporting and planning for supported decision-making if necessary. Other thing I will say about this age, when my daughter turned 18, I told you, I thought about it a week in advance. When my son turned 16, I said, we're going to get the POA drawn up, the power of attorney, because there's no way you're going out on your own with me not able to get records. And that became a non-negotiable in our house. If you want to do this, you want to go away to college, I will support you, but here are my rules. I need power of attorney. I need access to all of your HIPAA records. Every doctor you see, I need to be on that list. I need a file with the college that I can access your college records. And you're going to, for him, it was to play a sport, because in sports, they're on a team. That team will hold them accountable. He had a schedule. He was scheduled from 6 a.m. to 7 p.m. every day. He lived in sports housing. He lived all of it. And there are other programs like that for children who need a little bit more support in college if that's where they're going. So we set non-negotiables with him. We talked it all through, and he knew that if he wanted to do this, he had to agree to this. I still held the credit card, so that was very helpful. With my oldest, where we did not do this, she turned 18 and said, somebody else said it, I'm 18, I don't have to listen to you. She hasn't been to the doctor, as far as I can tell, in 3 years. And she is now living with the natural consequences. As a mom, it kills me. And I'm constantly going, Kaylee, did you go to the doctor? Mom, that's none of your business. I know, but can you just, Mom just wants to know. Mom, I got it. I'm handling it. She doesn't live near me. She lives in Alabama for a long time, just moved to Northern Virginia. It's hard, but it's also part of it. And it comes back to knowing your feelings, understanding the way that your role changes, and learning how to be okay with that. Now, the night that I dropped her off at her college dorm and she said, Mom, I don't need this. I don't need you anymore. I got it. I cried all night long. All night long. When I dropped my son off at college, it was 2 hours. My daughter is leaving for college in September. I think I'm going to be okay. I think I'm going to be good. We'll see. All right. Now we are cooking with gas. We are 18. And they are independent, and they will tell you quickly. And GOT transition says that this is when you start working with resources. I think you should actually start kind of talking that through at 16 or 17. If you've not connected with a transition coordinator before now, you absolutely should be doing it when it says 18. This can translate to, senior year or last year in high school or whatever you want. And this is where it gets kind of tricky because things have all different ages. So some things are 18, some things are 19, some things are 21. By the time they're 18, I think all of these things should have started to happen. And it lists on the GOT transition timeline as at age 18, but I'm going to say it needs to be by age 18. So understand what SSI is going to need. Understand what Medicaid is going to need. What does DDS need? What are the systems in place? Do they need supportive employment? Do they need the long-term waiver? there's so many terms out there. Working with a transition coordinator can help you understand what all those terms are, how they interplay, which ones you can have this or this, which ones you can have this and this. It's very complicated and complex. And somebody said this earlier, you will get multiple answers from multiple people. And the beauty of working with a transition coordinator, like we have Kelly on our staff who's wonderful, Lauren who is wonderful, is that they may not have the answer you need, but they can help you find it. And they're one more person to add to your support team so that when you're struggling with this, I've got to let go and I've got to find a way to help my child navigate, they can be a support person for you and your child. This is also where you need to start helping your teen, we're using teen now, make the transfer to their adult providers. You at this point know which ones are transitioning at what age. Start making the transfer. Transfer is different than transition. This is where they start transferring records from one doctor to the other. They're opening new patient portals or whatever they need to do to get switched over. And finally, help them start managing that healthcare information, right? They're carrying their insurance card. Maybe it's only a copy, but they're carrying it. They know that they need it when they go places. They have a medical record, whether it's in case of emergency on those phones is great because you can plug it all in. You can find apps where you put a little bracelet or a sticker on your phone or whatever, and it links right directly to their full medical record or whatever you want to put in it. On my kid's phone, I keep like a list in case of emergency of like all of their medicines, their diagnoses, and any other notes. So like Lily is prone to seizure if she gets dehydrated. So they know that immediately if they are out somewhere with Lily and she's like starting to get disoriented, fluids immediately, because dehydrated is a big trigger for her. And whatever that is for the child that you're working with. And now we're at 22 to 25. They are fully legal adults. Like I said, by this point, I'm hoping that you have power of attorney if they're going to let you have it. But they are adults now. And as hard as that may be for us to feel and deal with, your role now is support and encourage, right? So like my oldest, I can beg her to go to the doctor. I can send her insurance card and send her recommendations for providers near her. I can send her a list of OI specialists near her and support and encourage. And when she calls me and says, Mom, I'm having a really bad pain day, I can say, well, you know, if you went to the doctor, they could maybe help you with that. But I can't make her go. I absolutely cannot make her go. I could not pick her up if I tried to make her go. And at some point, our teens, our kids, our adults, they get that independent. Regardless of what we think they're capable of, they will start telling you no, or I don't want to do this. And they're adults. If you do not have guardianship at this point, they are completely independent. Acknowledge your feelings, get support if needed. Your transition coordinator can still be a resource. They can help you navigate, help you learn how to encourage your child to do what they need to do, or help you find new providers, or, you know, kids at this age might be moving around. They may be going to a group home. They might be living with friends. They may be whatever. And your transition coordinator can still help you as the parent and your child. And if you've built a good relationship with your transition coordinator, or if your child has built a good relationship with their transition coordinator, that is another supportive person in their life. And we know that kids that have at least one supportive person in their life have a 40% greater chance of success on most measures, whether it's, you know, graduating high school, graduating college, like all kinds of measures. 40% seems to be like the number of that you see on studies of a person who has a good, solid support person in their life. So I'm doing good. I'm doing okay on time. So our objectives today, we were going to talk about transition for children and youth with special healthcare needs. We talked about the milestones in the transition timeline, and hopefully I helped you understand some of the ways that a transition coordinator can help. I got my animations tonight. I'm going so fast. This is Kelly. Kelly is our transition coordinator at PIC. She graduated from Woodbridge. She is a Delaware resident for most of her life. She lived in New Zealand for a while and loves to talk about that. She has been a lifelong advocate for teens and adults. She works a lot with the LGBTQIA community. I'm kind of go through her bio. She did work for mental health court in Sussex County for a long time. And she is an adult living with autism. So that gives her a perspective that is really great for some of our kiddos. So reach out to Kelly. Absolutely. She can support you, your child. She is new to PIC. She's been with a little over 6 months. So she's still learning things, but all the staff is supporting her, and she is getting there and really enjoying working with the families. Questions? I threw a lot at you.
Yeah, I just wanted to to mention something quickly. You know, Suzanne shared a lot about her story and her personal experience, and that it's just that and everyone has their own personal and unique experience, and so, you know, for some, while it may be an option to talk to your child and have a power of attorney or a medical power of attorney, for other families that may not be an option. And so that might not be something that your child may want more independence. And so I do want to make that clear that that is not an endorsement either way from PIC. That is her story. And that works for some families. And that may be an option for you, and those are options, but that's one of many options, and why it's important to have those conversations and talking to your transition coordinator within your child's school, or some of the other resources that we mentioned today, or even reaching out to Kelly, because that those are opportunities to talk through your child's specific situation, and then making available the resources so you and your child, your student, your young adult can make informed decisions about what may work best for them. Also, Suzanne is absolutely right in terms of, actually both of you were right, in terms of when to start thinking about transition. In Delaware, from an educational standpoint, the school starts having those conversations with you at in 8th grade or at age 14. And your child is invited to a meeting. And if you've ever experienced that before, the first time at a meeting, they're sitting there like, what am I here for? And so really at Pitt, what we have talked to parents about is as soon as you get that diagnosis for your child, that is really the time to be thinking about, you know, what will life look like? What supports or services will my child need, or do I think they may need when they become an adult? And so if we get in the habit of having those conversations and those discussions very early on, the more comfortable we are and our children are having those conversations or advocating for themselves as they get older. So I just wanted to add that because this is not anything from Pitt. This is actually feedback that we've had from families that they felt that it's been really helpful for them to, as early as possible, to start planning and having those conversations. It's also helpful in your goals, your child's IEP goals, to because you can think about the skills. What skills will my child need to live an independent life, to be successful, and you can start working on those skills as early as possible.
Suzanne, we still have some time, and I stepped out, so please excuse me if I missed this. But for anybody that is on today's event, would you be able to share with them, how they can go about reaching out to Kelly if they've never worked with PIC before?
Sure. So if you've never worked with PIC before, we have an intake coordinator at this point, and she takes most of the initial calls. And she will take information and then transfer you over to Kelly to work with Kelly. If you call, you can call and ask directly for Kelly. But most of the time, we will come in through our intake coordinator so that they can get the basic information and start a file, so we can kind of track and make sure that you get all the resources you need. Our intake coordinator's name right now is Kiana. Kim in our main office also helps her with that. And they can also provide you with resources too when you first call. Fact sheets. Jaleesa brought a lot of fact sheets today. Kiana can send you fact sheets, Kelly can send you those, and then Kelly can work directly with you more to plan for your child, talk through your situation, figure out what resources she needs to find for you, or what questions you have, or just kind of walk through your situation and figure out the direction that you need to go. And a couple of the things that I know, thank you. A couple other things I know Jaleesa asked me to mention. So we do have a monthly call with the managed care organizations. And if you have medical questions that relate to your health insurance or navigating systems that way, you can call into that monthly MCO call. I think Jaleesa put something in the packets about that. And she asked me to kind of talk about how to navigate through your MCO. The answer is from your MCO, they're always going to tell you call your care coordinator, right? And you'll hear that over and over. With an MCO, they will assign you a care coordinator. If you've not been assigned a care coordinator, you can call in and they will assign you one. And that care coordinator is supposed to be another person to help you navigate. So you would be able to call them and they should be able to help you navigate your insurance. Like I'm right now dealing with an issue getting prescriptions for one of my children because they're one of those ones that's on shortage. And so our care coordinator is helping us navigate finding the pharmacies, getting the prescriptions transferred, all that kind of stuff. But they can also help you as you're working transition healthcare piece. Other thing I wanted to mention, on April 29th, this is also in your packet, we are doing another transition focused, what are we calling it, symposium. And it is in partnership with Easter Seals. Transition is such a big topic and it's so important that we wanted to make sure we gave it plenty of attention. So in April's event is going to be on a Saturday. It will be in person in both in Georgetown and in Newcastle. So you can travel to whichever one's most convenient for you. We'll talk about some of the same topics today. We'll have some different speakers and some opportunities to interact.
I'll be there again, but I'll talk a little bit more.
I know we were yesterday. You can have that back.
So for anybody that is still here, thank you all for attending. We're so grateful. I'll said this once and I'll say it again a million times. If it weren't for your kiddos, or in this instance, your adults, and you, we wouldn't be here. We wouldn't do the education. We wouldn't do the presentations. It's really focused and centered around them and what they need, and they need you. And you need this information. So please know that Family Shade is here. We work with the Parent Information Center. That's what we do. And you're always able to reach out to either of us. When you reach out to Family Shade, we'll answer any questions that we can. And then what we're able to do in this really wonderful partnership with the Parent Information Centers, we then follow up with them if a family needs a, transition coordinator, if they need a member of PTI, if they're looking for the F to F program. So please continue to reach out. Family Shade also does monthly trainings, sometimes every other month, depending on a holiday or if there's vacation time. So keep a lookout for any Family Shade emails and correspondence with PIC and their emails. We have the evaluation that will come out to our online attendance via email, and then you all have the evaluation today. Again, that helps us just to gauge where we're at, what more information we need to do, if there are any more events or specific topics that we can support on. But really, I just wanted to take the moment to thank our presenters. So Lauren, Derek, who is not here, Suzanne, thank you. Kathy, thank you. Margot, thank you. Everybody that is here that was willing to share in the chat, share here, has had the opportunity to network or get more information or really build a partnership, because that's really what it's all about, is just building that circle of people that can help support you as you support your child. So I will send more of this information from today out via email to everyone. You all have it in person. You all will get it online. If you have any questions, comments, thoughts, please feel free and encouraged to reach out to me or to follow up with the Parent Information Center. But that is the show, everybody. That is all. I wanted to say thank you again. Everyone drive safe. Drive safe when you leave your home or wherever you go next, and have a really lovely weekend with your kids and your adults.
Thank you.
Thank you. As soon as you walk out the door, you'll see the doors are open.
Yeah.
Oh, thanks, Margot. Thank you very much. Oh, so the dual program is another PIC program, and so what the duals do is they support birthing families as they go through birth. So it's pretty blanketed. We ask about a lot. You won't have to answer about the duals. I think we didn't really talk about that today.
Thanks, Kathy.
That's okay. People were listening. They were listening. All of that.
Like a bullet train.
Oh, I don't have to. That's okay. We've recorded today, so don't worry. But that was really great. Thank you. That was really, that was really great, Kathy. Thank you so much. I know you're always so willing to like jump in.
Well, I just remember struggling so hard with things that I want
Yeah. No, this is great. And I'm really grateful. I think you're absolutely right. Like, I hate to say it, but you're not the only parent that has gone through this experience or that is going through this experience. And so when we come through and we're able to share that, it's like